Hi, hello, and thank you for joining us. My name is Julie Hollinger, and I am the Programs Manager at the Petawawa Military Family Resource Center, and we are coming with another Fireside Chat. I want to thank everybody for joining us. We have a few folks on the line here that I'm going to introduce in a second, but I did want to make people aware that we are going to be talking about suicide today. So I want to be really put that out there as a trigger warning. If this is a topic that is particularly sensitive to you or something that you are going to find disturbing, we want to make sure that you are aware of where the discussion is heading. We are at the end of the session going to put a lot of resources in the comments. So if there's information that you find troubling, please feel free to reach out and take care while listening. In terms of our panelists, we have Dr. Heidi Cramm and Dr. Denise DuBois. They are both from Queen's University. We have Claudia Beswick, who is the Executive Director of the PMFRC. We have Captain Susie Baudouin on here twice. We're not entirely sure, but we'll see how that goes. She is a mental health nursing officer at Garrison Petawawa at the Warrior Support Center, and she is also the general mental health team lead. So we appreciate her being here to talk about that component from the military side. Before we start, Claudia, there have been a lot of changes in the last couple of weeks in terms of COVID restrictions and what we can and can't do. Do you want to just give a brief description about what's happening with the PMFRC and maybe what's open or not open and what we can expect?
Sure. Staff really are slowly returning to regular office hours. That's not every day, 5 days a week, but it is more on a regular schedule. And we have about 50 or 60% of the staff that will be back in the offices starting next week. Our North Side office, as usual, is open from 8 till 4, Monday to Friday, as is our employment office in Petawawa. So full services are available, as well as walk-ins are welcome. If you're looking for support in your job search or resume, we encourage you to call the Employment Service office before you just walk in. That way you can get an appointment and make sure that someone is available to help you. The Deep River Employment Office is open Monday to Wednesday, 8 to 4, but it is closed for lunch hour from 12 to 1. Anybody that is having an in-person appointment with staff, that may be the case for some of our clinicians and or new families coming to the area or the Veteran Family Program Coordinator, please remember that you must be vaccinated and masks must be worn. So we do still continue to do the screening and contact tracing at our locations. Play Troop will officially reopen as of 1 March, but a reminder that it is by pre-registration only and numbers are still limited. So we're still limiting our capacity in that sense. And anybody that is attending must show proof of vaccination. Please use the Play Troop email to make your contact for registration. Specialized care continues, and it's all for the CAF families, and you can access the service for various appointments, mental health breaks, which is really important these days, and or if your family care plan fails. So there are both hourly and daily rates available for this service, and there will be an intake process in order for you to access it, but it is very simple, easy to reach out and very quick to register if you need the service right away. And I'm sure Julie will have the link for that contact in the comments below. Kitty College is also open for mornings only right now, and there is still space available for that program. So connect with us if you're interested in that. And finally, we're hoping to have the Southside Community Center fully open to the public, hopefully mid-March timeframe. And more information will follow on that once we have all of those details and how we can make it a smooth transition for our families, because that is a building we share with our PSP counterparts. So I think that is it.
Thank you, Claudia. So I'm going to start with Dr. Heidi Cramm. Heidi, can you tell us a little bit about your research and what led you to study suicide as it pertains to CAF members and their families? Where did you start?
Thanks, Julie, and thanks so much for the opportunity to come and connect with you today and with your viewers. So, I'm an occupational therapist, and I started working in Kingston about 20 years ago and worked in child psychiatry. So we saw an awful lot of military families, and there was nothing that could help me really understand why I was seeing so many military families. So that kind of led me down a circuitous path that ended up, when I did my research training and I went back to university, and I ended up in a faculty role, and I ended up in the department where the Canadian Institute of Military and Veteran Health Research, or CIMVR, was launching with Dr. Alice Aiken. And so I really turned my attention to military families and mental health in particular. And so, I've been looking at where and how families are included in conversations about mental health, and mental health can be understood within these family systems where families that are experiencing kind of these increased challenges to day-to-day, week-to-week life because of the nature of the job, what that means for them. And so, looking at issues that come up for military members, for veterans, suicide prevention is an issue. It's been a big priority for a lot of different militaries. And it got me to thinking, as we get exposed to these kinds of conversations, and these, in the US, in the UK, in Australia, what's everybody doing around suicide prevention in militaries? And it really struck me that families weren't part of that conversation. And so a few years ago, I worked with a group of my international colleagues to try and create an approach to study this. We had done some previous work that really just looked at, what does it mean to be a military family? How's it defined in different countries? And why does that matter? And so it kind of morphed into, well, this is a really good area to build on that international comparative work, because we really wanted to be able to understand where and how families are or are not included in this discourse around suicide and suicide prevention. So that's kind of how it came to be. And we ended up taking that through that international collaboration. I had cause to connect more with members of the Center of Excellence for PTSD that's based here in Canada. And they decided that they would fund this study. So that's how we kind of launched into a pretty deep dive on understanding suicidality in military and veteran families.
Thank you. Not that long ago, the discussions about suicides on public forums, it just wasn't happening. Denise, can you tell us a little bit about what you learned in your research about the conversations about suicide prevention and why it's important to talk about it?
Absolutely. So I'll start with sort of just talking about what is suicide prevention, what does it include, and sort of how did we come to understand it for this research project. So first and foremost, suicide can be preventable. And there are many different kinds of prevention efforts that have been looked at in the research and that are also available in programs or practices. So we can kind of think of three different kinds of prevention efforts. The first being that more universal. So it's for everybody in a population like Canada. And that will sort of involve more knowledge, awareness, and even culture shifts to help seeking and having conversations like we are today. The next kind of prevention effort is selective. So it is looking more at groups that are seen as at risk for suicidality. And unfortunately, military and veteran populations are considered an at-risk population in many different countries, including Canada. There's also indicated prevention efforts, and those are particularly for individuals who are already experiencing suicidality. And I should just clarify that you will notice that we use both the word suicide and suicidality sometimes. So suicidality is a larger term that includes thoughts about suicide, behaviors associated with suicide, and can also include suicide death or a completed suicide. So really we need to know that suicide has devastating consequences for any of us who have experienced suicide in our families or communities. We understand those consequences. There are outward ripple effects that we see that are different than other kinds of death. And some of those include the ideas of clustering or contagion. So some of us might have heard that term before, a suicide contagion, where other people in a community experience a suicide and then themselves start having suicidality. So really, this is a public health issue, and suicide prevention is thus not only about before a suicide death, but also after, for the community and family around the person. So then we can kind of understand that suicide prevention happens along a pathway where at the beginning, it is for people that are at little risk, but maybe need more awareness and education, individuals that are at higher risk for suicide, and also continues right after a suicide death into what we talk about as postvention. So just for some examples, so we kind of understand, suicide prevention programs that are more universal or upstream include building knowledge, awareness, cultural shifts towards help seeking. So how do we talk about it? How do we even ask somebody about suicide? Whereas suicide intervention programs, they're a type of suicide prevention, but it's how to intervene with someone who is experiencing suicidality. And so things like gatekeeper training, assist training, crisis hotlines, counseling, and safety planning are examples of suicide interventions. And then postvention, which I mentioned before, is after a suicide death for the people around that person. It's very important in military communities. And this could include things like peer support programs, bereavement counseling, as well as commemorations, and really making sure that we memorialize the individual who's passed. So hopefully that helps you understand a little bit of how we've understood it in this project.
So I'm going to ask you the question. I think a lot of people, when you hear research, I think people kind of panic a little bit that it's going to get a little deep, or it's going to be like too much for them to understand. I think there's a lot of jargon, but can you sort of explain to us what you learned in your study about suicide prevention?
Yeah, absolutely. So I think the first and foremost, is that there's a lot more that we need to understand about how to best intervene with military and veteran families who are experiencing suicidality themselves. And that includes within the military and veteran family, the military personnel or veteran as well. So there are three main ways, though, that we did learn how military and veteran families were included in research and policy about suicide prevention. So the first way is the research has looked at how being part of a family or receiving social support can protect military personnel and veterans from suicide. Alternatively, the research has shown that experiences of relationship breakdown, absence from family through deployment has been associated with higher risk of suicide in military personnel and veterans. Now, that does not mean that every person who experiences a relationship breakdown or absence will necessarily become suicidal, but that the research has shown that this sometimes increases that risk. So this work is pretty peripheral to how to best serve military and veteran families, but it makes up a lot of the research that has been conducted to date. So there's two other ways that family members have sort of been looked at in suicide prevention. So the first one is focused on family members, but especially spouses, as a caregiver or an intervener for a military personnel or veteran who is experiencing suicidality. So for example, some of this work has looked at how family members can be involved in developing safety plans or decreasing lethal means capability. And that's a sort of fancy way of saying making sure that guns are not available to an individual when they're going through a crisis period. So while family members are still more central here, this work still assumes that the experiences of suicidality are in the military personnel or veteran and not in the family member themselves. So the final area of research focused on family members as the population of interest. So this work is a bit of a mixed bag. Some of it looks at the level of suicidality in military family members in comparison to the general population or peer group. So this work actually suggests that at least in the US, spouses and partners and military connected children do seem to have higher levels of suicidality than non-military connected individuals. What is sort of generally missing though from this research is an evaluation of suicide prevention programs or services for families. So there is still much to do, and we will actually be building on our existing work through a continuation of this project with the COE on PTSD to now look more broadly at best practices in suicide prevention for all families. So not just military and veteran families, but like what happens sort of in the civilian system as well, to see what or how these programs and practices may be relevant to the military and veteran, as well as the public safety personnel family context.
Thank you. It's a pretty deep discussion, and I think in some people it can be a little bit scary, and people sometimes they see signs or they wonder if they're seeing signs and they don't necessarily know what to do. Captain Baudouin, if you, I guess the question that I have pertains really to military family members. If I'm a military family member and I am concerned about my partner who is a member, I'm not really familiar with the military system. What can I do to encourage them to get help, or what can I do to make sure that person doesn't fall through the cracks? How does the work on the CAF side?
On the CAF side, there are many options, I guess, that we can do. The most important thing is support, right? So the spouse needs to be supportive, reinforce that it's okay to go seek help. Unfortunately, there is still a stigma that's attached to seeking mental health. So I think it's really important that we reinforce the fact that it is a normal thing, it's part of life, and it's good to go. So the first thing is you refer them back to the CDU, so their medical clinic. We have an intake worker that's there from 7:30 in the morning till 3 o'clock every day. So that intake worker is really there just to see walk-ins. So anybody that's struggling here and now is going to be seen by someone. That's our first thing. And then behind the scenes, that intake will be referred. We will make a referrals for them to get access to services. They'll be assigned to a social worker, a mental health nurse, or psychologist, psychiatrist, depending on the needs.
So if something were to come up, not in that sort of Monday to Friday, 7:30 to 3 time frame, what would you recommend for families?
So the first thing is CFMAP, so the Canadian Forces Military Assistance, Member Assistance Program. So that's a 1-800 number that we can definitely give out. That's I'll give.
We'll have that in the comments below. We'll add it to the comments so people can find it easily.
All right, perfect. So the CFMAP line is definitely something that is a crisis, but also a referral. So it's a self-referral. So the member will call. They will. The intake worker will say, is this person at risk, yes or no? And even the spouse could call for the member if they really don't want to. And then within a couple hours, they usually get a phone call back, with someone who's going to be able to take them on. There's also the crisis line that we have. So the mental health crisis line, which is 24 hours. Same thing, another 1-866 number, so a free line. And that is absolutely for the crisis. If the member has a plan, if they feel unsafe, the best thing is to take that member and bring them to the PRH. So to get assessed right now and then by a doctor and a psychiatrist.
And by PRH, you mean the hospital, correct?
Yes.
Okay, so if someone's watching from outside of Pembroke, I just wanted to make sure that they sort of knew that equated to you can bring a military member to the hospital.
Yes, you can.
Thank you. I appreciate that. I wanted to do a little bit quick translation here. Claudia, we talked to Denise as well. She talked about how suicide affected family members as well. So that's sort of how the CF member can maybe get a little bit of assistance, can get the support that they need. What about family members who are feeling that strain, either as a caregiver or noticing signs in themselves, in their children, or CF members that are seeing in their spouse that maybe there's something they should be concerned about? How can they get that support? You're on mute.
Sorry, see, that always happens. Okay, so we already talked about SIFMAP, and I think it's important to note that the family member isn't just the spouse or the partner. It's also the kids, the youth, that kind of stuff. So this is open when we say family, it is the full family. So SIFMAP was already identified. There's the Family Information Line, or FIL in short, and that's Military Family Services have counselors available, and they provide these services 7 days a week, 24 hours a day. It is a bilingual service, and you'll get connected to some experienced professionals that are well versed on the CAF communities and services, and they'll be able to direct you just like SIFMAP. It runs like SIFMAP, but this is specifically with Military Family Services. There is a crisis text line for kids, and Canadian Forces Morale and Welfare Services has partnered with the Kids Help Phone, True Patriot Love Foundation, and Lockheed Martin Canada to launch a crisis texting service for kids from military families living in Canada. So children, youth, young adults from military families can access free mental health well-being support by texting the keyword CAF Kids at 68686. And Julie, I'm sure will provide that below. And this service is in English. So the text line is powered by the Kids Help Phone, is confidential and available day or night. There is Life Speak videos that D&D has partnered with Health Canada Employee Assistance Services to provide the defense team and their family members with access to this mental health and well-being resource. Life Speak is an online health and wellness platform that includes videos, podcasts, action plans, and Ask the Expert sessions on 22 subjects that will provide insights and help manage mental health. We have spoken before. We've actually done fireside chats with the Strongest Families Institute. This is a service available for children or youth between the ages of 3 and 17. So that is accessible as well. And finally, there's the OSIS Operational Stress Injury Social Supports. So there's a lot of networks out there. You can reach out to them directly. You can reach out to the PMFRC. We do have clinicians on staff. We have family advocacy coordinators that will link you up with community resources if that's pertinent. We also have a youth counselor that is in 2 of the high schools, Bishop Smith and Valor. So there's a lot of touch points out there, and we say this a lot, no door is the wrong door. So don't worry about who you're calling, just reach out, and we are well connected with community resources that you will get the supports that you need.
You're not calling the wrong number. Call any of them, and someone's going to help you and put you in touch with the support that you need. So please don't sit there and think, I'm not going to reach out because I don't know which number is right. They're all right. Heidi, coming back to you, if someone's interested in finding out more about the research that's happening in regards to CAF families, in regards to CAF members, is there a place where they can sort of go and access research that is accessible to someone who is not a professional?
Thanks, Julie. So we've recently tried to consolidate the research that we're doing with military, veteran, and public safety personnel families under one umbrella. So the Families Matter research group. So that's where we have information about all of the researchers in our group, as well as all the different projects that we're engaged in. It also has links to things in case you missed it. So things like the link to the Suicide Prevention Military Families event that we did, which was a 2-hour panel and presentation series with the Center of Excellence, the COE PTSD, back in November. And so it's a place that we can go to kind of centralize the work that we're producing and make it easier for people to keep abreast of what's happening now. One of the things that happens with research is that it can take a long time to produce it. So we can go from having the idea, getting the funding, and actually doing the research to then being able to share the results of it. And that can take several years to move through that process. So we want to be able to make sure that people know what we're doing currently as well, so that they can be looking for that information as it comes online. So we have more accessible descriptions of what we're doing and why we're doing it and what we're finding on that website.
So I'll share that information below so you can check that website out. There's a lot of really good information there. And it is written, there's summaries and there's things that are written that you, even if you are not a professional, even if you're not a researcher, you're going to be able to take a look and find those core elements that, that you're really looking for. Claudia, I've got an extra question here for you. One of the things that really struck me when Heidi was talking about earlier was, you know, the fact that there were these discussions that were happening, there were decisions that were being made, and families weren't being represented there, that when they were looking at it, families didn't necessarily have that voice. This isn't a new question for you, and you talk about it quite often. We really want to hear from families. If a family member has something that they're seeing, if there's a barrier that they're facing or a program that they are interested in, that they're not seeing in their community, how do they get a hold of you as the executive director at the PMFRC, and what happens with that feedback?
There's a lot of touch points for feedback. I'm only one of the long list. All of our team knows that feedback is important. So you could be attending any one of the program's activities or even on a virtual session and offer your feedback. It doesn't necessarily have to be about the activity you're in. It could be anything. We are always listening. We are always open to hearing what families would like to see. It's not that we could always do something, but we could maybe look at ways that we could provide the service or partner with somebody else that is already providing the service, but kind of educate them a bit on the unique lifestyle that military families face. So a large part of our job is collaborating with the community partners. And so, you know, the more that we learn about trends and the research that Heidi is doing with her team or any of the other organizations, it really helps us build a platform of baseline services. MFRCs across the country, there's 32 of us, and we stay connected regularly as well. And we share our expertise, we share our services and programs and reach out where we can. So, you know, if there is a program in Edmonton at the MFRC there that you think would be beneficial in Petawawa and we're not doing it, then let us know. We'll reach out to Edmonton. We'll try to do something here. There might be something comparable and vice versa. Don't wait until you're here. If you know you're coming, you know, MFRCs, we are here to support the families and to address gaps and barriers for services that are in the local area. Here in Petawawa, we are very well versed with our community. We have staff that sit on community committees. We stay connected nationally with organizations that are doing the research and providing additional supports. We hear from you and we share that locally, nationally, provincially, however we can and whoever wants to listen. So feedback is so very, very important. And Julie, I'm sure you will have all of the emails, touch points. However, I am at work 5 days a week in the office. Call me, email me. There's feedback links on our CAF Connection site. We are putting out as much information as possible through Fireside chats, through our podcasts, which Julie, I'm sure you're going to touch on that as well. Just let us know. This isn't about waiting for a survey that may happen every couple of years. This is telling us if you are struggling or if you have an idea or just want to share your story, let us know. Let any one of my staff know. They are willing to listen.
Thank you. It was just a point that Heidi made that really struck me. And I think it's important that military families know that their voices are heard. And that's how change happens when we know what those barriers are and we know what we can do to make this to support. If this is a topic that really interests you, the research element and finding out about the research that's being done with CAF families, Heidi is the special guest on our podcast for Military Family Life that's coming out in March. So we're going to be having a little bit more of a different discussion, but a little bit more in depth on the research that she's doing, how that research is coming together and how that research affects families' lives further down the road. This is an important topic and sometimes discussions sort of happen and I don't pick up on all the points. Is there anything else that someone wants to mention before we go? Anything that I've forgotten to talk about or anything that you want to add? I'm going to take that as a no. Thank you everybody for joining us. And I think that the going out position really is if you need support, if there is something that you need, if something in this discussion has disturbed you, has made you think, and you need that support, please reach out. The support is available. The information is going to be in the comment section. It's a difficult topic sometimes, but I think it's a very important one. So we appreciate everybody for joining us. And thank you. Have a great day.